Right, today is the 16th of May and this is my top surgery update. So I had my surgery on the 21st of April last month with Ms Walls' team, which I was actually operated on by the surgeon called Ms Grit Dabritz, and there was a couple of other what looked like young trainee surgeons there as well. So Ms Walls is still kind of present in a, how would you put it, a consulting kind of role, but she's not actually doing any of the hands-on surgeries anymore, so it is just this new surgeon called Ms Dabritz. But anyway, I've had the surgery done and I'm happy with it. I'm still annoyed about the situation that they put us in where we're not allowed to choose our surgeons, but because I haven't had a really bad result, you know, some of that anger has been mitigated quite a bit, so I'll go ahead and show you what it looks like if I can get rid of my layers. So as you can see, it's pretty good. It's very flat. I keep on looking at myself in the mirror. I just cannot, you know, I can't believe that it's actually happened. It's really, really good, I think. There's quite a bit of swelling still. I don't know if you can see it, there's a area of swelling here which I think is going to go down. There's a small dog tag under my arm here. You know, this nipple's a little bit lopsided, but you know, for all that could have gone wrong, I think this is pretty good. It's a good result and I'm happy with it. So I'll keep on posting some updates as it heals. I've ordered some silicone strips off of Amazon, which I figure they're supposed to be used on keloids and kind of bigger scars, so I'm hoping that I don't need to use them, but just to see whether it does work. I think after another 3 weeks or so I'm going to start putting them across the scars here. There's almost nothing to be seen around the nipples. The only thing that annoys me quite a bit is that there's a scar here from the surgical drains that went in, and I don't know how you can see that. It indents quite a bit and I can actually feel the scar running up under the skin, almost as if there's a tube still in there, which I know there isn't, but that's just annoys me a bit because when I stretch up, when I stretch up I can feel it pulling right there. But there's been almost no pain. It's been a really, really easy recovery. I've been sleeping on the couch and I've hooked up my PC to the TV here so that I've got my entertainment. But it's been a lot easier than I thought it was going to be. This is my first surgery. I've never been to a hospital before for any reason, so I didn't have a clue what to expect. But it's, you know, the general anaesthetic was no bother at all. I woke up straight away, didn't feel bad at all for the rest of the day. 2 days in hospital were really easy. The only complaint was how noisy it was. When you're getting your surgery with Janet Walls' team, it's in the North Manchester General Hospital. You spend 2 days after the surgery in it's a men's ward, but there's about 20 or 30 beds in there and it can get really noisy. If I could go back and do it again, I would have brought earplugs. Not much else to say about that. I'm just really happy that it's been done. The other update that I want to make is about the Minoxidil that I've been using, but there's not really that much to be said about that. I went off my testosterone for about a month before this surgery, as doctor's orders, and because some minoxidil works in combination with testosterone to create facial hair, there was just not much point wasting it while I was dehormoning. So I've kind of been looking at the results of what happens when you're not using it for a month instead of progress I'm making with it. On the sides of my face, just get comfortable. On the sides of my face, my sideburns here, they're getting a lot darker. Don't know if you can see this again. Down the sides to about here, and the same on the other side. These are actually filling in quite well, and I don't know whether that's the minoxidil or the testosterone, but I'm quite happy with those now. But under my chin, where I had almost a fairly even amount of growth, there's now a big patch has appeared where the hairs have come out and it's starting to grow back in, just, you know, like peach fuzz, colourless. I'll post a photo of kind of this area here just so you can see it a bit more clearly. My upper lip doesn't seem to have changed at all. It's not getting any darker or any lighter, it's just as it was. So fingers crossed that starts filling in again, because I've had my my renewed shot 2 weeks ago and I've started using the Minoxidil again, so hopefully we'll see some updates happening. I think I'm also hoping that maybe some chest hair will fill in now. I think something quite weird that I noticed was that before the surgery I had sort of like a halo of hair around my nipples. So now that that's been moved down, I've got like chest hair just above the scar lines, nothing below the scar lines, and the nipples are just sitting out there on their own. So I'm kind of hoping it fills out a little bit, maybe hide the scars a bit. Can't think of anything else I was going to say, but if you've got any questions or anything like that, give me a message. And I've also put my pre-op and post-op photos, like close-ups and stuff, up in Transbucket. I've screwed up the surgeon's name. I put her forename before her second name or whatever, so if you search for Grit Dabritz as opposed to Dabritz Grit, you'll find the pictures that I've put up in Transbucket. But that's it for now. I'll post another update shortly, probably next month or maybe in a couple of months' time.